Hello, I'm Patrick Hoggard, Vice President of Medical and Scientific Services at Zoetic Science, which is the newest medical communications agency within Ashfield Healthcare. Today I'm going to show you how, by choosing a career in a healthcare communications company that is fully engaged with its employees, you're able to improve lives. I'm going to talk today about some of the aspects that you need to consider when you're planning a career in healthcare communications. When selecting the company you work for, who should you ask? Is this an organisation that gives you what you want? Think about the environment within the organisation, the career opportunities that it affords, and the development of the individuals in that organisation. This is a busy slide that shows the elements of Ashfield Healthcare communications. There's 4 areas. On the top left hand side you see the multi-channel healthcare communications, of which Zoetic is one. In the centre we have specialists and centres of excellence, and on the right hand side we have the integrated multi-channel services. Ashfield collaborators, shown in the bottom right hand side, such as nurse educators and call centres, is also part of our network. So you see, I work for Zoetic Science, and this is where Zoetic Science fits within this huge organisation within the network. If you choose to work for a larger healthcare organisation, such as Ashfield, you'll have the best of both worlds. At Zoetic Science, we have our own identity, our own subculture, if you like. But we also have the benefits of being part of this wider organisation. We have insights, opportunities and security within that. And as you'll see later on in the slides, being part of this larger network also gives greater opportunities for career development. So, based on the slide above, this shows the breakdown of the network. So you see that approximately 60% medical and scientific services and client services, but we also have essentially 11% of the team are working on digital, and then we have approximately 30% that are others, that are support services, consultancy, congress exhibitions, and the research group. So what are the benefits? What does that give us? Well, the research group, we're better informed in terms of marketplace trends and compliance. Opportunities, there's greater opportunities for collaboration, opportunities to work on a wider range of different projects. And as mentioned, we have the security of a larger organisation. If you lose some business, even a large account, we have the flexibility so people can switch on to other accounts in the wider business. Business wins, we have the support network to help deliver that new account effectively. Mentioned it's a large organisation. This is sort of illustrating the geography. The offices around the world now are locations. Locations: UK, Ireland, US, Germany, Japan. Some of the agencies, such as Circle Science, support both are based in the UK and the US, and they're able to sort of support clients for a longer part of the working day. I think it's worth highlighting that this is just showing our locations. We have a number of people, as it mentioned at the bottom of the slide, that are actually not constrained by office locations. Our office is based in Macclesfield, my team, but 2 of the team members that I have live in Cornwall. We have approximately, getting on for a fifth of people who are working at home either full-time or a part of their contract working part-time at home. Also, the actual level of part-time workers as well, we have approximately a fifth of people, 20% of people in Ashfield and Zoetic Science are working part-time either 3 or 4 days a week. So, assuming you've chosen this as the career path, how do you fit into a large healthcare communications company? Does the organisation have that environment that allows you as an individual to develop and to diversify? So when you're looking at your next career move, have you chosen a business that has a strong strategic narrative, shown on the left-hand side? What is the company's purpose? What's the intent, what are they trying to achieve, and by when? And it's important to communicate this because as an employee you need to know why you're there and how you fit into that wider business. The second part, engaging managers. Is the business engaged with its managers? It's a well-known fact that people leave their managers, not the organisations, and it's managers that are having a vital role ensuring that people are feeling stretched, ensuring that people are reaching their full potential. And one of the things that sort of Ashfield have done is a significant investment in a leadership management programme in order to ensure that the managers are able to coach and stretch their people and treat people as individuals. Employee voice and involvement is the next part I think that you need to be considering. The first thing around employees, I think probably all healthcare communications agencies will say they value their employees, but do they from top to bottom throughout the organisation value people? I think what you need to do is see that employees are central to the solutions. People are able to challenge views. At Ashfield we've done a Denison survey. For those that you're not familiar with Denison, it's a measure of sort of the cultural organisation. And what it allows is everybody within the agency has completed that Denison survey. It sees where there's things that are working, things that are not, and then we're able to act upon that. The fourth part, organisational integrity. I think a lot of agencies will have values, but I think the thing to remember, are they just values on the wall, or are they actually reflected in the day-to-day behaviours? So I'll just go back to the strong strategic narrative. At Ashfield, we have a strong mission. Our mission is to partner with our clients, improving lives by helping healthcare professionals and patients get the medicines, knowledge and support they need. So when you become part of a healthcare communications agency, either as an employee or as a freelancer, at Ashfield you can clearly see what your role is, how you fit in on a daily basis, how you will improve lives. This is the bit with regards to organisational integrity and the values that we have. These are our values that we have, the 5 values: quality, partnership, ingenuity, expertise and energy. They're not words on the wall, they're built into everybody's objectives. Every individual, that's from our parent company's senior leadership downwards, is measured against these actual values. So when you're considering who to work for, it's important to consider what these values mean to you and how you can demonstrate them on a daily basis. In the middle we have ingenuity. It's key to staying ahead, easy to say, less easy to do. You need to create the right environment for it. And as part of setting up that environment, Ashfield, we have lab time. So what's lab time? Well, lab time's a good example of the commitment of the business to our values. To be inventive, you need to have the time and the space to do that. And each member of Ashfield Digital and Creative has 100 hours per year. That's equivalent to three weeks per year where they're able to investigate any area. And this is extended to other members of the network as needed. So, large healthcare communications companies have lots of opportunities for careers. What jobs are available? Well, traditionally there's 2 major pathways, specialising in medical scientific services or in client services. The 2 pathways are shown following on from that here. In large medical communication companies, there's usually opportunities at all levels. Isn't always the case in smaller agencies. For instance, it may well be that there's a number of account directors in a smaller agency, so the scope of moving into that role is lesser. But as I mentioned up front, part of the benefits of working for a large healthcare communications agency is the network and the opportunities that are outside this typical career pathway. So this is the slide that showed before with Zoetic Science, but what does it mean? Clearly there's other communications companies that we have here within Ashfield that I could work for, move to, but the opportunities are a lot wider than that. And what I'm going to do in terms of showing a little bit of that flexibility is just provide you with a couple of case studies. So we have, on the left-hand side, you'll see that it says career and motivations, and this is the career pathway of somebody, Elsie. We'll just call her Elsie. Elsie works on the medical and scientific side, joined after a number of years in clinical trial management, joined Ashfield Healthcare as a medical writer, and has developed through senior medical writer, principal writer, and scientific director before moving into a director of editorial operations role. Through this time, as you can see at the bottom, Elsie has worked located in the south of England and has achieved a sort of their career development throughout, always working from home. During when she had had children, the two children, she was able to work part-time in order to maintain a work-life balance. Now the children are a bit older. She's gone back full-time, but has some flexible working hours. As Elsie was wanting to sort of gain more responsibility, expand upon the strengths and where she wanted her career to go, she's moved from scientific director to director of editorial operations. The second person is Katie. So Katie's on the client services side. Katie started as an account executive. Her main motivation for coming to Ashfield and working in essentially a healthcare communications agency was to have a fast-paced environment with a clear plan for career progression. And Katie has done that and has developed, as you can see, from account executive, account manager through to account director. As part of that, in order to better develop, Katie has moved agencies within Ashfield. And then to challenge herself to something new, Katie's last move has been to a healthcare communications agency with a large public relations component. So what I've shown is the network where people can develop, but I think the next part is to consider is actually around developing individuals. Does the organisation look at you as an employee or as an individual? Does it allow you that environment to actually develop? Should we remember that people are actually not ready-made for all roles? What they need is to be able to progress and to have a clear development plan to allow their employees to flourish. And at Ashfield, we're committed to developing individuals as part of their career pathway. So, for long-term success for a business, it's critical to have staff that are the most highly skilled, informed, and motivated. How do we do that? Well, it's through continually providing the best quality training, development, and support. You may well have heard of the academy that we have, the training program that was for associate medical writers. It's a good example of supporting people to develop. But what we've done is using that framework, we've expanded that to provide bespoke training programs for all employees that satisfy their career needs. I think one of the things that I hear from freelancers is that they feel that they essentially stay still, they don't have the same opportunities to develop, and I think that's one of the things that we have, that your career is moving on in a large healthcare communications agency. So let's look at a little bit around the actual training and development. This slide just summarises the training development plan. Development is we're using a 70-20-10 rule with 70% in-role learning, 20% personal development, 10% training. Training is a huge focus within Ashfield Healthcare. We have a full-time training manager who works with all the people in the agency to develop a strategic training program that fits in with their needs. The core training itself comprises four elements, if you like: compliance training, training that's critical to everyday effectiveness, the development training programs that I'll talk about in a bit more detail in a moment, and managerial and executive training programs. And then there's bespoke mentoring and coaching programs as needed as well. So what are the training courses available? Well, in 2015-2016 we had 35 training courses running. That was just under 1,500 training places offered. A number of courses that would cover industry knowledge, leadership and management, compliance and best practice, business skills, marketing skills, and now we're looking to do digital skills as well. As an example, as part of industry knowledge, I've been involved in a clinical pharmacology workshop, providing attendees with a greater understanding of a lot of the pharmacology terms and the pharmacokinetic studies that are used in everyday practice, which has been a really sort of rewarding experience for me, as well as providing some benefit for each of the individuals. I mentioned Ashfield's commitment to leadership and management development. One of the key parts is Inspire, which is a leadership development program. It's a 2.5-day program and it's based on our values. I mentioned that the importance of our values and that everybody's measured against them. And actually our values are defining our culture, and the creation of Inspire was very much seen as a key central activity in creating that values-based organisation. And to date we've had 100 leaders from Ashfield Healthcare Communications completing the programme. In addition, we have a one-day management course called Drive, which is aligned to Inspire, which all managers within the organisation complete. So you've heard about Ashfield. We are a people-first business. The Ashfield way engages everyone. It's giving us something to work towards collectively, constantly challenging us about thinking about the impact we have. And as part of that, we have Ashfield Cares as well. Ashfield Cares is using our size, our resource as well, to have a positive impact on our local environment. For instance, it was great to be involved as part of the activities that have been raising money for East Cheshire Hospice. So I've shared what I think you should be looking for in terms of a large-scale healthcare communications agency, provide you with an overview of the features that you should be considering in terms of a future career. So thank you very much to everyone. Thanks for Peter and Network MedComms. Thank you.